1 million Virginians have no health insurance. Increasingly, they are our neighbors, friends, and family. A single, unforeseeable moment can devastate a life, perhaps even yours. The Virginia Healthcare Foundation stands in the gap, making primary health care more available to uninsured and medically underserved Virginians, people who would otherwise suffer untreated. The Virginia Healthcare Foundation, standing behind community programs that touch thousands of lives across the Commonwealth. Welcome to Health Cares with your host, Deborah Oswald, Executive Director of the Virginia Healthcare Foundation.
Prescription medicines. These drugs have changed many of our lives for the better. They cure our children's earaches, help us manage and control chronic diseases like high blood pressure and diabetes, and they can often eradicate cancerous tumors. Given our current economic state, a growing number of Virginians cannot afford the medicines they need. More and more people are forced to make a choice: fill a necessary prescription, or use the money to put food on the table or pay the mortgage. Fortunately, many Virginians won't have to choose. There is help, and getting that help is the focus of this edition of Health Cares. Welcome, I'm Deborah Oswald. With me today is Mark Grayson, Deputy Vice President of Communications and Public Affairs for the Pharmaceutical Research and Manufacturers of America, also known as PhRMA. Mark is the driving force behind the Partnership for Prescription Assistance. Mark, I want to thank you for joining me. Please, tell me more about the partnership.
Well, the Partnership for Prescription Assistance, a mouthful as well, is a clearinghouse of more than 475 programs that can help people who are uninsured find out about programs to help them if they can't afford prescription drugs.
Who is eligible to participate in these programs?
The people who are most eligible are the people who are uninsured and don't have any prescription drug coverage. So what we try to do is find people who are either uninsured, that are working 2 jobs maybe, they don't provide health insurance or prescription drug insurance. Some people have health insurance, but they don't have prescription drug insurance. There are some people who have just been laid off from their jobs. We encounter students. They just got off, they've been in school for a few years, and so they now are not on their parents' health insurance anymore. So they obviously will need some help before they have found a job. And so those are the kinds of people that we have been able to help.
What are the criteria for participation?
Well, the first criteria obviously is that they don't have prescription drug coverage. Other than that, the criteria depends on what their family size is, with the economics, how much they make. Each program is a little bit different, and so it's hard to say that one program specifically is the specific economic program. And the reason for that is that some medicines, as you know, are specialty medicines like for cancers and things like that, and their costs are a little higher, and therefore the criteria might be a little more lenient than for medicines that are for everyday chronic conditions.
So what medicines are available through this? Well, just give us some examples.
For the Partnership for Prescription Assistance, as I said, we have 475 programs. 190 of them are through the pharmaceutical companies. Some companies have more than one program because of the specialty drugs. But almost every brand name pharmaceutical is available for free or nearly free. And then we've got a number of discount programs, especially from the generic companies, and people can pretty much find almost every single medicine that's available.
And so I was under the impression that mostly it was medicines for chronic illnesses, but is it for more than that?
Well, most of the medicines, because it does take a little bit of time, it's mostly the best use of them are for chronic illnesses.
Okay. How long has the partnership been around?
Well, the Partnership for Prescription Assistance started in 2005 with the Help Us Here Express, which is the bus that has been going around the country. In fact, we've hit more than 2,000 cities in all 50 states since 2005. And in Virginia, we've actually been here more than 6 times. We've helped over 120,000 people in Virginia get access to free or nearly free medicines. But we know that we need to help a lot more people, and that's one of the reasons I'm glad that you had me here today. We just did a tour throughout Virginia, and we know that we will be back early next year again.
And this is a great time to let people know that Montel Williams is your spokesperson for this program, and people may recall seeing commercials on television that have Montel Williams and the bus.
Correct, and we've been really pleased. This is the only program that Montel Williams has ever endorsed, because he really did, and if you talked with him you would know he really believes in the program. And so we've been very pleased and appreciative of all his work.
Let's, I think you brought one of those commercials for us to look at today. Let's take a look.
From tornado-devastated Greensburg, Kansas, to hurricane-stricken New Orleans, Partnership for Prescription Assistance is bringing hope to people in need and communities in crisis. This is Montel Williams. The PPA, sponsored by America's Pharmaceutical Research Companies, has been to 2,000 cities in all 50 states, helping more than 5 million struggling Americans. If you're uninsured and need a hand paying for medicines, call now to see if you may qualify, because America's Pharmaceutical Research Companies want to help.
That's a great commercial.
Thank you.
How do people get help when the bus isn't in town?
Excellent question, because that's really what the idea about the bus is, that we create awareness. But most people really do get their help by calling our toll-free number, which is 1-888-477-2669, or going to our own website, which is pparx.org. Now, the toll-free number is available 14 hours a day, every day of the week, and people can get the same help as if they had gotten on the bus. We have great operators. They speak over 150 languages, so we're able to help a large group of people.
That's really wonderful. What do you want people to remember most about this wonderful program?
There are a couple of things that people should know about it. And it's a great program. It's been around for 3 years. The companies have had these programs for 50 years, but it's obviously with technology and being able to get the bus together and wireless, we've been able to go around. But there are 3 important things about this program. One, this is totally confidential. So if people call up, they go on the website, we don't save any information except to make sure that we send them the medicines that they need. 2, this is a totally free service. So we want to make sure people, it doesn't cost anything to find out what programs are available. And 3, this is for people of all ages. So, if you are between the ages of 18 and 65, because I know in Virginia you have children's programs and obviously there are Medicare programs. We want to make sure that those people know that there's help out there for them.
Okay. Well, we are very fortunate that Pharma has put this partnership together, and it is doing wonderful work. And we thank you so much for coming to share that information with us today.
Well, thank you so much, Deborah. I appreciate being here.
As we've learned, the Partnership for Prescription Assistance has given millions of uninsured Americans the medicines they need. If you need help, give them a call or go to the Partnership's website, pparx.org. Next up, a special program that helps seniors and their families with the ins and outs of Medicare Part D.
Have you ever delayed filling a prescription because you couldn't afford it? You're not alone. A recent survey found that 41% of adults throughout the country had a problem paying for the prescriptions they needed during the last 2 years. 23% of them skipped doses or cut their pills in half. 29% didn't even fill the prescription.
Uninsured Virginians